next session is going to include remarks from our Region 8, as well as from Tracy about some historical context on enrollment in Wyoming. Before we begin, though, with that, we're going to have John Hannigan. It is our pleasure and honor to have John Hannigan with us today. He's a CMS representative from Region 8 that has always supported the work that you do very much. So before we hand it over to John, please remember this is a one-way presentation. So if you have any questions, please write them on the parking lot over there on the wall. So and then we'll certainly get those to him after the conference. So we appreciate you doing that. John Hannigan is the let's see if I'm having trouble seeing my notes here in the dark.
Sorry.
That's okay. John Hannigan is the Regional Administrator and Staff Director at CMS, and he is joining us virtually from his Denver office. So we appreciate it very much having him with us. John has agreed to give us some opening remarks to really kick off open enrollment for us. So let's give him our attention and welcome him.
Okay, all right. Thank you, Melissa, and thank you, Joe. As you can see, large disembodied head on the screen. I couldn't really hear what Joe said. I think maybe he unfortunately had to read you that overly long bio that they keep sending out. But here I am, as close as I can get to virtual. But it's important. You know Dennis. But I really wanted the opportunity, and I asked Dennis if I could have the opportunity to speak with you today on behalf of the CMS regional office and also our HHS colleagues. Lily Griego, our regional director, couldn't be here, but she specifically asked that I pass on her appreciation from the HHS regional office. And of course, I would rather be up there in lovely Casper enjoying a beautiful day with you all. But it's just nice to take a couple minutes and speak with you to let you know, even though I'm down here in Denver, we are with you, we're watching, we're proud of the work you're doing, want to make sure you have all the information you need to do that great work. Enroll Wyoming, and some of you individuals in the room there have been with us from the start. The Affordable Care Act was designed to ensure that we have coverage and good quality health insurance that's affordable for everyone. We built onto that with the American Rescue Plan and the Inflation Reduction Act. And you've seen all these things come to pass. We know that you are face-to-face with the individuals in your communities, and you're helping them get that coverage. And your data shows that. Last year, you had a 30% increase in enrollment. And this year, it's hard to believe, right? 10th open enrollment period, less than 3 weeks away, and it's coming. And from what I see and what I hear, you guys are ready to go, and you're going to go out and even improve upon all the wonderful work that's done. I don't know all the conversations that have gone around. You may have heard that when I say we, I mean I personally, in conjunction with our Chief Operating Officer of CMS, were able to get up to Cheyenne last week, meet with Jason and Dasa. We also met with the governor and health officials from the state of Wyoming. We're really energized on Wyoming this year, and I hope to get up there some more in the coming months. But it's really, the key is just people, right? We can have all the systems in the world, but it comes down to you. It comes down to us getting you the right information, you out there sitting with the people in your communities that need help. And your work, your passion, your creativity really came through. It comes through every day, but in the visit, we got to sit eye to eye with the people doing that work, and it was very touching. I know John Blum specifically went back to Baltimore and DC with a new appreciation for both the nuances in the state, your political environment, geographic environment, and the great work that you're all doing. Also with your 2023 grant summary, I know there's a renewed push this year to align with the CMS initiatives and pillars to include the racial and ethnic minorities, which encompasses American Indians, rural communities, LGBTQ, low-income or homeless, and anybody else that needs this help. And again, an emphasis on mental health and substance abuse-related disorders. To because of course, you know, some of the most needy and underserved populations that we have. And we know we're looking to include them in these programs this year. So we're working hard to get you the 2023 plan landscape information. And we're really hoping on news soon on the family glitch, something recurring that we hear about all the time, thinking that's going to be fixed, but we want something definitive to get to you. And then more program improvements as we go along with that ultimate goal of quality, affordable health coverage. So really, there's a lot of other people that are doing the nuts and bolts work. I offered this to Jason and Dasa. If you need me specifically for anything, feel free to reach out to our team. Anything that you need to support you and go out and help those people that need that coverage, educate them, answer their questions, listen to their specific needs, pass those back through. I can assure you too, when we get that feedback, especially when it's something unique or challenges that you can't handle, we channel that back up, and sometimes we can get some answers and actions on those things that may seem like insurmountable challenges. So it's an honor for me to join you, say hello. Most importantly, thank you for your dedication to helping the Wyoming individuals and families get coverage. I know you face a lot of obstacles, especially COVID-19, some funding level changes, and you worked your way through them with just grace and efficiency and a real caring for the people that you serve. So enjoy your conference. Have a great OEP coming up. We are here. I'm sorry, I think I just lost my camera. I'm back.
Yay! Oh.
Welcome back.
Doing good work, and it starts with you. So thank you, and have a great conference.
Okay, wave like this. Yay!
All right, well, we appreciate it too, and it's a great team and a pleasure to be working with you.
Thank you.
All right, bye-bye.
Bye.